Good morning and welcome once again to Daybreak Africa from our studio in Ondo State, which is the sunshine state of the nation. It's a beautiful morning. My name is Ikhonede Joshua Odeji.
Good morning, my name is Odunayo. Welcome to Daybreak Africa. Good morning.
Good morning, good morning. It's another morning again entirely in this country, in this space, and everywhere. You see, this week, a lot of things have been happening.
Okay, like what?
A lot of things have been happening in the actual sense. A friend of mine recently made contact with me. He actually had a girl he wanted to get married to. So recently he discovered that she had a disease, STD, and she never told him.
She knows.
She knows.
She did not
She did not tell
She
him.
did not treat it.
She didn't treat it. She was treating it locally with local stuffs, thinking the thing was gone. So recently the guy had an issue, only for the guy to go to hospital, and they said, and this guy is someone that is not totally sexually active. You get, now we do call them bolo, simp. You understand? So he just want
try new
thing before marriage and all that. So he just went, and immediately he went that route. That route handing what he's selling. You know.
I feel for him.
I feel for him seriously.
For a first timer.
For a first timer. That's the problem. A first timer. For a first timer. You know, he was saying that if he was someone that was doing it constantly now, he wouldn't have, but he is not promiscuous. And this is just a sexual partner he's just having. And this is the first kind of experiences. Though ever since they began, he confessed to me that they've gone like times, but
thank you.
But bro, now he's now complaining that, but he thought that the girl was, because you know they met themselves at
church,
righteous places, and the two of them have been. So he was thinking she was not knowing that the young lady, it was by confessions that we began to discover that the girl had an history.
Oh God.
And even though she claims she changed from that history, but then the
history has repeated.
It has repeated itself. She played.
I like to hear this kind of thing.
And the foolish thing was, she was making use of local stuffs.
That is very, very
local stuffs, thinking those things will treat that.
Okay, I am a female, and there's some treatment that you should take as a female, either you are sexually active or not. We have the pelvic, I think the pelvic treatment. You know the way we female are
your body structures and all that.
Then our genital parts is kind of sensitive. when you bend down, it kind of expand. So when you want to pee, you bend down. You want to put, you bend down. It's not until you start having sex that you start trying to treat yourself. Those things pile up together. That's why when some people get married, they tell you that, oh, they have delay in childbirth. It's not because there is one Omoyeme most times.
Which people think.
I
think that Omoyeme part.
There's one family, people that is following them. Sometimes you need to treat yourself ahead of times. You must have a specific time that you visit your doctor. Okay, I want to, let's treat this. You don't until you are sexually active, because your body as a female especially,
it's gone.
You need to pay attention.
Well, I think we'll be looking at that, honestly, looking at the STDs, because this is not even the first time. It's becoming very rampant in our society today. Here, this in the last few months, I know how many cases that we've heard so far and all that. We'll be looking at that holistically on Daybreak Africa today, but when we get there, please let's take the reports of the day. After the reports, we go straight to our discussion, so please stay with us. We'll be right back.
Good morning and welcome back to Daybreak Africa, and this morning we are going to be having a very pressing health issue that affects our society, especially the younger generation. We see that even with the fact that enough information has been passed down from generation to generation, we still see the high increase in STD, especially in Nigeria. And this morning we are going to be talking about the causes, the effects, the prevention and cure to the increase in sexually transmitted diseases. And we have our guest in the studio with us, who is a medical practitioner and person of Favour, Omoyeme. Good morning and welcome to the show. I hope I pronounced that name very well.
Maybe you're supposed to pronounce it again.
All right, can you just tell us your name?
Okay, my name is Favour Omoyeme.
Omoyeme. Oh.
Sorry, I'm so sorry about that.
You like to spoil people from my state today.
It's not as if I'm not doing that intentionally, honestly.
Yeah, I know she's not doing it intentionally, but then it's part of life.
It's good to have you on the show this morning.
I don't know. I thought we were going to do your ladies thing. You look pretty. You look beautiful.
I'm still going to that. Just take a chill pill. Okay. Anyways, you are beautiful, and I'm just over this. After the show, I will tell you my.
Well, let's jump straight to the topic before we lose the whole intentionality of the whole show. Now, there's something that is trending in the society today. People are talking about the place of sexually transmitted diseases. You know, I used to, growing up, I used to think it's just a farce, though I know some people who has it, but then it's becoming extremely rampant. I recently saw a 14-year-old young boy. I just saw him hitching, and I asked what happened.
What's going on?
Then a friend of mine told me he had, I don't know what they even call it, sweetie or something, they call it in Ondo and all that, and I'm like, wow. And they said some guys were just saying at that age they have like 2, they have like 3. I'm like, Jesus Christ. Like at that age. Now, why do you think this is becoming extremely high in our generation today?
Okay. Like you said, the boy you saw was 14 years old. So it started like, okay, it all starts from early sexual habits. Okay, so from a young age, young generations are already partaking in sexual activities, and it also increased the risk for it. And that 14 years old, I'm sure he does not have knowledge, doesn't know I'm not sure he knows what is happening. He doesn't know anything about. He does know. I don't feel all he does the pleasure from it. He don't know the dangers and all that. So, and why I feel it's now very, very, very high in this generation, as I've said earlier, early sexual habit, and now like sex is like a normal thing, very normal, like
extremely normal.
Those days, when we talk about it, you just close your mouth and say it.
Till date, I could not kiss on my wedding. My mom was seated.
But now, besides you, like it's it's something that is like
it's normal.
Yeah, it's now very, very like it's much more accepted in the younger generations. That's why there is an increase in the risk and increase in number of people having the STD.
But sometimes I ask, don't they know, because you talked about sexual habits and all that, which I think is something I think we can look into just for some few minutes in the actual sense, because I think you said something that was very profound, that when we were younger, it was way difficult to even talk about it on the open. Even programs like this, parents will never agree that their children should watch it. They'll be like, hey, go inside, and all those kind of things. And some of us, we got to know about it maybe the older we got, or by the time we were getting to university, we began to move with friends and began to know, oh, this thing really happens for real. Okay, that's true. For me, that is my own entry. It's not your entry. But then, sexual habits. What will you define sexual habits as in people? For those that don't actually know what sexual habits actually involves or inclines.
Okay, sexual habits. Just okay, it's an habit. Okay, it's a habit that defines, like that expresses how you do your sexual intercourse. And how often, the frequency, the way you do it, the measures you take to prevent it, what causes the habit, like, and why you engage in the habit. Yes, that's what I would say sexual habit is.
So definitely it's like your orientation, the pattern that is to say, I wonder what orientates people that makes them become like this. Because if a 14-year-old boy can be so active to a point that you encounter such a thing, do you think that encountering sexually transmitted diseases takes time? Like maybe you have to be doing it consistently before you get there, or maybe
or just one,
it could be just one hit and then boom, you're gone.
You have the disease.
Like there's this popular adage that it's a Yoruba adage. It says that what Taye will do and Taye will die, Kenny will do it and Kenny will not die. So like someone can have it do like a sexual intercourse just once and immediately within 2 to 3 days, like that's the minimum onset. Within 2 to 3 days, person can have it straight.
Jesus.
Why some people can be doing it for 3 years
4 years.
and nothing has happened to them till now. So it's just, I don't know, maybe grace or luck.
All right, so I would like us to talk about the current situation of this disease in Nigeria currently compared to the previous year. What is the, how will I put this now, the striking difference? Do you feel like it's becoming too much in this year compared to the previous year?
Yes, it's becoming too much. Because 20%, like in this generation, 20% of sexually active people have had or they are having currently sexually transmitted diseases. That means if there are like 5 sexually active people in a room, one of them will surely have, or they've had it before, or they are having it currently. That's just it. That's like how bad it is in this generation compared to
the past.
Yes, the past, it was really low. It was really low. I don't think it was up to 20% in the past. But now, among sexually active people, 20%.
Already.
That's 1 in 5.
1 in 5.
1 in 5 people. That is in 5.
Yes, 5 sexually active people.
How do you even know someone is not sexually active? Because
I think we should really talk about that. How can you know that, oh, this person is sexually active?
I don't think there's any way you can know. It's not written on the head that, oh, I'm sexually active. It's not written on the head.
Okay.
Yes. I don't think you can know.
How?
Unless the person is maybe a vulgar person and there's some, you know, patterns the person begins to show you that you have to have a high level of, you know, sensitivity to know that someone is actually sexually active. I don't think you can know. The person said it.
even that vulgar part, I think that vulgar. I've seen someone that was vulgar, and I think that was last week. A very vulgar person that a friend of mine discovered she was not active, and you were like, wow, really, for real? And she's extremely vulgar, and she's not active. That was the shocking thing, the most shocking revelations I had last week. You know, every week it comes with a new revelation. But then, let's progress a bit on this particular topic. Now, you're talking about the place of sexual activities, sexually active and all that. But over the years, which do you think, now let's go into the place of sexually transmitted disease or infections proper. Which do you think are the most common and that people should even look out for at this part? Because they have many names. I don't even know till today what sweetie is. Only God knows what sweetie is. I don't know if you know sweetie. I don't know what it is.
I don't know what it is, but I know that when maybe there is a scratch down there,
some will say gonorrhea,
the male will call it sweetie. I think that's their own redefined method of calling.
Most common.
Okay, a lot, like a lot. If I'm to mention them, but the one that is very common, gonorrhea, is very common. Even my neighbor could have treated gonorrhea. Seriously.
I hope your neighbor is not watching this.
Okay. Gonorrhea, HIV and AIDS. Like people would think, oh, HIV, because I told someone that okay, HIV and AIDS is real. The person was looking at me that, what? You want to do something, you should do it. Us that have been in clinical environment before, we see cases like that, like fresh people looking fresh, they are there. Yes, it's not written on the face. So as I was mentioning, gonorrhea, HIV, AIDS, human papilloma virus is now common now. The one that causes cervical cancer is very common now, very common. We have herpes, we have hepatitis B and the likes.
Which is the most underrated? Like people don't really put, but it is extremely underrated.
I feel gonorrhea should be on. No, I feel herpes should be underrated because people don't really rate how serious herpes is. Like even through kissing, someone can get.
Yes. What are the symptoms? Really, I don't really know. So what are the symptoms?
Yeah, like a visible symptom is, you know, someone having sore on the mouth. So just avoid kissing people like that. Like those people that you see, they'll say it's malaria.
It's malaria.
Okay. I don't think so. So it's not everybody that has sore that is actually having herpes, but just avoid kissing people like that.
Okay.
And also another one is having sore on the genital areas. So that's another symptom, but you won't really see it until you're already in that room. So but just having sore on the lips is very prominent.
Jesus Christ. You said there was one that caused cervical cancer that is now very common. I think I'm interested in that a bit.
Yes, human papilloma virus. You know that females are actually on the receiving end now. They are not suffering it. It's male actually transmits it, and actually it can also cause other cancers in males. But the cervical cancer, it just affects females because it's only female that have cervix that it affects. So it's now common. And male and the male gender, they are the active carriers. They carry it very well and give to the female. Yeah.
All right. The other time you mentioned the fact that when you were growing up, that sex is something that you cannot proudly speak about. You have to just, you know. But now we are seeing younger generation coming out to say that, oh, I was deflowered when I was 14, when I was 12. I'm like, really? Okay. So don't you feel like the cultural, how will I put that? The cultural, the way our parents or people around us, the elderly people, the way they just take us away from knowing about sex education. In some home, the parents don't give sex education. They will see it as if they're teaching the child something very bad. I don't know if you've ever had that kind of experience. Yeah. So don't you think that shielding us away from that kind of education is part of the major causes of these things?
Yes, that's actually true. Because I feel if our parents have sat us down, tell us that, oh, this is what this sex is, this is exactly what it is, this is how you feel when you have sex, and these are the dangers, these are what you should do to prevent it, this is what should not happen, this like if they've given proper sex education, I feel the children of these days won't have to go outside and learn it the bad way. Because I feel one way they can learn it is through social media, you know, all these sites and all stuff like that. Yes, and when they learn it, immediately they are seeing, what their eyes is seeing is pleasure. They are all seeing, oh wow, this thing is, oh,
the fantasy.
I can't wait. And you know what, all those sites, all those videos, they look so appealing. You say, this thing is all that good. And they don't really have that right knowledge. If the parents have actually sat down and tell them about it, that this is what it is, and it has a lot of things to, it has a lot of negative parts, and the positive parts to the pleasure to is there. At least they should tell the children about it. And there's also like age appropriate sex education. You know, you can I don't think it's appropriate for you to explain the process of sex for a very, very young child.
They begin to drink.
But there's a way, there's just something called age appropriate. There's a way you can be telling them that parent, don't let this boy touch your don't let this boy touch your breast. Did he touch you? Stuff like that. It's just a little, they are just little ways of sex education, but it should not be did you touch? No, you sit the child down and tell the child what it is. I feel early sex education will help.
So at what age can you give a child proper sex education?
I feel as long as the child already into the society, know that you will say, okay, this is sex, this is this. No, like.
But you know that sometimes we have the early maturer and we have the late maturer in everybody. Some of us are early maturer. Some people can be very, very dull since when they are getting to like 20 before they will
taking notes from this.
20 before they start knowing what even some things are all about. But some kids at 10 they already know. Sharp kids. They are highly mature.
A bulk of kids are our ancestors.
Actually, they know a lot.
So what is the proper age to tell them that this is that?
I feel there's no proper age. Okay, for ladies, when the child is already entering into the puberty stage. Around 10, I think you can start appropriate sex education. This is sex. This is how this. I know your body is not good. Try to give them reinforcement that is not easy, but like just encourage them. But for people below 10 or people that they are not like that much, like they are not really
sharp.
Yeah, exactly, they are not really sharp. You can just say, oh, don't let like for females, don't let anybody touch your breast.
This is a bad touch.
It's a bad thing. Yes, if anybody touch you like that, it does not mean well. Actually, it doesn't mean well. Don't let anybody touch your bum, all those small education that the parents gives. Those are actually encouraging. And I feel parents should also tell the child why, because you just say don't let someone touch you. You want to ask why let this boy touch you,
and that's why the thing that just take us there.
Exactly. Why you explain that okay, any sexual habit is not good. They may not even understand, but just tell them in a way. You can just demonstrate that if they touch this like this, it can lead to another thing. You understand? I just feel, yeah, if for children above 10 that are really into puberty, you can give them appropriate sex education. But people below like 5 can just be doing all this, don't let someone touch you, if someone touch you, come and tell me, and things like that.
Which is something that most parents should know, and which is a very big cost to many of these things, and especially parents that even open their televisions to kids on even phones to see, make them see things like this. Now it's becoming spread and it's becoming very increased in our society. I think we've talked a lot about the causes to a very large extent, and now let's talk about the effect. Now, if it continues like this, because now you said something which is very funny. You said in the years past it was never like this. But these days we're having over 20%. In a point that in every 5 person, 1 person is not saying this thing. Now, I know if it's psychological effect, that one, let's leave that one aside. But now, let's look at the effect itself on society, on the person themselves. How low can a sexual transmitted disease take people? Like at least your top 5. If I ask you now, what are your top 5 that you know that can destroy totally? What would you say are the top 5 STDs that can really destroy someone totally, extremely?
Okay, all STDs can destroy, but okay, the lowest point STD can bring someone is death, because it can kill. So the top, you asked the top 5. Top 5 STDs. All of them can kill, but it just depends on how, early detection, how how the person manage it. But I feel the most deadliest of all is HIV. Yes, HIV. Then herpes.
Herpes too can kill.
It's dangerous. It's a virus, so very, if someone then syphilis.
There you go.
Yeah, syphilis, because it can transmit to child. My top 5 for let's hepatitis B is very deadly. Last one, what will I call it? HPV. It leads to cancer.
Yeah,
and
HPV.
If cancer is not manageable, it can spread from cervical cancer. It can turn to brain cancer within days. Years. So that one is very deadly if not managed well.
But the other time you mentioned HIV, I want to know what's up with HIV and AIDS. No, and AIDS, because some people will be like, HIV you can still manage it, you can still treat it, but you see that AIDS, no go area. So I want to be very sure.
Okay,
I want to be very sure.
Okay, it's like end stage of HIV. Like HIV cells have multiplied, they are now numerous in the body. So AIDS too can be managed. HIV is more manageable. That's what I would say. HIV is more manageable. Like it's just like stages of growth. How far HIV can go is AIDS. Yes, HIV is just the beginning. They're just starting now. Yes.
Well, we'll come back to that in the actual sense. Let's take Go Start. Immediately after Go Start, we come back straight to our discussion. Yeah, and it's getting interesting in this particular place, so you don't want to miss the concluding part of this discussion. So please stay with us. We'll be right back. Welcome back. If you just joined us, it's still Daybreak Africa, and yes, I hope you enjoyed our Go Start. But then it's time to return straight to our discussion. Before we went on the short break, we've been looking at the issues of the increase in sexually transmitted diseases, the causes, the effects, the prevention, the cure. And we've been discussing with Favour, Omoyeme, and it's been a very wonderful discussion in the actual sense, and you've been scaring me in the actual sense. Let's be truthful with ourselves. Talking about the effects and the top 5, especially herpes. I never knew herpes was this. I remember they took a very popular musical artist to court in the United States because he was spreading herpes to young ladies and all that. And he's a very popular artist. He's sexy. The guy is sexy in the actual sense. So girls love going to his concerts, they're hugging, and then the aftermath of it all. Cool. But they never knew, he himself did not know he had. Which makes me realize that there are some of these things that people can have them in their body and not even know they have them. What are the things to look out for to show that, maybe my body is already telling me that I have this particular thing?
Okay, I think if person cannot know, but okay, if someone knows that, okay, if a person knows that, I'm sexually active, there are some things you can look out for. And also, if someone is sexually active, I think the person should be doing regular screening, like be going to hospital. I want to check, yes, I want to check, want to do blood tests and stuff like that to check. And other things someone can know, like some signs, like sores on the genital tract and sores on the mouth for herpes now. Another one is painful urination. Person is just feeling that when someone wants to urinate, it's so painful, and foul smell for the female, foul smell, painful sex, also discharges, like foul smelling discharges, green discharges from the genitals. Yeah, those are signs. And eye fever, someone is sexually active and the person is having fever. It shows that the body is trying to work to protect the person from an impending danger. Yes.
That eye fever, what do you think is cause? It could be the likely chance of it.
Okay, fever is a lot. Like fever is the symptoms of fever is a symptom of almost all diseases. So, but if someone is sexually active and maybe person have treated malaria recently, person have treated typhoid recently, I don't know, just if someone have fever, I can't just say that someone have fever is because of STD. No. If someone is more stretched out, person can have fever. Fever is a symptom of almost
everything totally.
Yeah, so I can't really say, but if someone notices fever, I feel it's right to go to the hospital safe and check. And when they're asking you, in the hospital they will obviously ask you for your sexual history. So if you can say that, and they can point their test in line to that and other things too.
So the scariest part of it is that some people won't get to know. So definitely, if you are sexually active, consistent medical checkups is very, very important. But let's talk a bit about prevention, because I think that's one part people don't like.
Yes.
You don't like that part because they think it's too strict. But let's talk prevention. If at all one wants to prevent, how do you think one can prevent themselves totally? Because some people definitely will not hear word, but how do they prevent themselves from sexually transmitted diseases?
The best way to prevent is abstinence. Yes.
Okay.
And before you and to reduce the amount of sexual partners that you have, and before a person have a new sexual partner, they should do tests. I feel in Nigeria it's just weird, Just saying. So I was talking to someone one day, and I don't know, it just became a point of conversation that I asked that, because the person said he was sexually active, and I asked that, have you been tested? Person got angry. I was like, these are normal conversations supposed to have. it actually depends on who you ask the person though. You can't be asking one random person. You know, we are actually very close. Yeah, so I feel I had the floor to ask that type of question, and the person got angry. I could not even apologize, because you know, I feel that it's a very, very, very normal conversation you should have with people that are close to you. It's a way of educating them that this thing is very, very important. Very important. So back to what I was saying. Before someone have a new sexual partner, person should have tested, asked. Another one is reduction of
sexual partners.
Yeah, reduction of sexual partners, and also, let's say, actually, like, if someone is not sexually active, they should not even start it at all. Because once you start, it's very hard to stop. Yes, another one is the major way. First is abstinence. The second one is now use of condom, not anyhow condom, latex condom. Yes, and for appies and all these oral sex and stuff like that, you can use a dental dam. And yeah, it's not. I've not seen it in Nigeria. I have not seen it though. It's all online.
So anybody that is doing all in Nigeria,
there's this. I think there's this kind of chocolate they use. I don't know, something like chocolate.
You know, to this point. Good.
Yes.
Wow, I'm surprised though. I'm actually surprised. I'm really surprised.
I'm shocked. I don't understand. I'm shocked. I thought she was my Jew.
Okay.
To my conscience.
Okay. Speaking of what did they call it now? Protected zero bad condom now. You know, I was having a conversation with someone of recent, and the person was saying that, okay, for a Christian brother, there is no way you will go to a pharmacy. You will feel ashamed to say, I beg, I won't buy this thing. Many of them are doing these things. And because they are ashamed to go to the pharmacy to buy this, so that one church member will not see them, or one of their, you know, will not see them. And they are involved in these kind of things. What do you have to tell them, please?
It's Nigerian factor, because see, abroad is very I want to do this. You won't you'll be bold enough to say, okay, you are not married to someone, you're bold enough to go to the hospital. I want to start doing this. This is my plan, you know, and people will not judge you. But that's typical of the factors that are promoting it, because why will you stigmatization? That was it's called. Like, why will you stigmatize someone that is trying to protect himself? I just feel that we should be more open. You know, healthcare providers, pharmacists, they should be more open. And I feel people too should not be you should know what you want to gain from this thing while you are protecting yourself. So I feel some people should not be embarrassed to go to the pharmacies. If people are talking, you know, it might ruin your steez, but it's you that know what you aim to achieve.
You are the one that knows you.
Yes, so I just feel that people should not mind going to the pharmacies to get condom, and Christian brothers they should not abstain.
Why must Christian brothers? I don't know sisters involved in this.
Muslim brothers too.
I don't know religious people involved in this.
Just Muslim brothers.
Even married people going to pharmacy
to say they want to buy. Exactly, that's why they'll be having multiple children, and you be like, I shouldn't be not.
You know, the thing is, in Nigeria we have a pretense culture, where in the actual sense, we are all doing something. Like the issue of Big Brother Africa now that people were talking about recently and saying, don't watch it, they should cancel it, and I'm like,
it's a lie.
Their viewership is high.
Who are those watching it?
You won't tell me that. You'll be shocked that some people will preach about it on their pulpits,
and they will still
maybe
go
their
back
mosque, and you ask yourself questions. The details this guy is talking about, how do you know this? Even me that watches, I don't know. How do you know these details? Which shows that everybody's watching. The truth is, maybe if Nigerians can do that, all of us are in this group chat. Let's just accept
one
it.
way or the other. We should not stop. I think we should stop pretend. Everybody should stop pretending. Let's just be open. I'm doing it. You are doing it.
But I have a slight question, because I think I had a conversation with a lady that was 3-4 years ago, and I confirmed this from another lady as well. Maybe not just one. I think I've heard it twice randomly from today. You know, all these bar conversations you could be with your friends and adults having conversations, and they just say it, and they're like these issues with, like you said, you told the guy about testing. They don't want to go do a test or to check themselves. In the same way too, they have these issues with the condoms you talked about, in the sense that I've seen it that will tell you they don't like it when someone uses condoms with them. They don't like it, and these people are, when I mean extremely active, you know, there's active, there's this ones are now, this was they are born with activities, and you ask yourself questions. But this thing is extremely dangerous. There's nothing will happen on this, that, and they say we have local this, we have local that. Now, what's your comments on people like that who tends not to? There are a lot of them like that. They tend not to like the condoms. They say, maybe you talked about latex and all that. Many of them don't want to use those things in their actual sense, and they still want to keep being active. How do you? What do you have to say to people like that? And some of them likes local treatment of things, like for ladies, you know, the infection flusher. There are some that you ask yourself, which NAFDAC confirm this thing in the actual sense, because they use a whole lot of things these days. You see, guys, if it's about guys, when it comes to their drinks, I'm still pitying people. That one, I'm helping them to keep their words in cooler, because I know that the day your liver will tell you the truth, you'll be scared. But what about people that local treatments and still don't want to use the actual condoms and all those kind of things, and they don't want to do tests?
Actually, there are people that really react to condom. Some, I hear that some will be like, oh, it limits my freedom and things like that. For men that react to condom, I feel the female can use condom. There's a female condom. The female can use condom. Another thing that I want to talk about is, yes, if the female feels she's not satisfied, the person can get like lubricants to use along with the condom to enhance more satisfaction. Yes, and another one I want to talk about, another thing you spoke about is the use of local drugs. Those drugs are deadly. They are deadly. They are deadly. I don't even know how much I can explain it. I can almost say almost. I don't want to bring. Herbs are very, very deadly, especially those ones that someone beside your house produced, and they don't even know how they produced it, the water they used. It is very dangerous because it's. I heard a story online that a person took an infection flusher, infection kit. She bought it from online store and she almost died. And that thing is that it can cause kidney damage. Those drugs, you will go to the KCC. If you go to KCC here, you see, you know, young people with what? If you check their history, you will see that it's too much overuse of herbs. They'll be using it back to back, and some people, they are, you know, some people now say, oh, Shebi this person, this girl, I know Sade is she have her own kids. Sade is LD. Not everybody have grace. So as I said earlier, what Taye will do and Taye will die. Kenny will not die. You don't know how your body is. You don't know your genetic your predisposition to it. You know, some people, they are, you know, they might have history like their forefathers died of kidney disease. Those people, they can't know now. They don't know their forefathers. So that means they are very, very sensitive to it. But they will not want to hear. They'll be copying their friends that, oh, nothing can happen to them. It's actually dangerous. I feel they should stop it. And one way, okay, some person don't want to use condom, rather person don't want to stop having sex. I feel person can just reduce their sexual partners, and also before the person have new sexual partner, the person can go to the hospital to check and do tests for sexual disease, sexually transmitted disease, and they should make sure they are faithful to each other. In that way, you know, I don't think there will be spread. There will be limited spread.
Okay, so you already mentioned the local drug now. I get that. So what about people that use, they will say, it's antibiotics. If I use it, it will flush away all the infection in me. What do you have to say about that? Is it really working, or they are just using it? And what do you have to say about that? Does antibiotics works now?
Yes, antibiotics works, but I don't know. Why are you prescribing, unless it's prescribed by the medical doctors? I don't think someone should take antibiotics, because antibiotics, they increase the resistance. You know, if you've noticed that, okay, even down to malaria self, if you've taken a particular malaria drugs, if you're taking a particular malaria drug for a while, you will notice that this drug is not really that strong on my body again. So it's same as and it's more deadly for sexually transmitted diseases, because the more you take over-counter, that's unprescribed drugs, the more the infection becomes stronger. You're just giving them strength. So antibiotics works, but person has to go to the hospital. They will do a blood test. There's what they call sensitivity and culture. They will test that this particular gonorrhea or which drug will work for it. You know, you go to the hospital, you see that there's this person that will have a particular disease, and almost all the disease is resistant to almost all antibiotics. Because this person caused it. You know, and the person might directly get the resistance one from the other partner though, but the person, it can be due to overuse of antibiotics. Yes, that's just it, and it's actually really not good. It works, but if it's not prescribed, it's bad.
So what do you think is the perfect steps one should take for cure when it comes to issues attached to sexually transmitted diseases? Because I know many people would like to know at this particular time, because you've told us not to use all these old things, and many vendors are angry to sell at this particular time. So what then should we do to ensure that at least we are treated perfectly?
Yes. The road to cure is going to the hospital first. Go to the hospital, tell them what's going on with you, like you'll be seeing some changes, and that's the best way. Then the doctors prescribe what to use, and there'll be follow-up, you know, and will save a lot of lives that way, instead of taking fashion flusher, those over-counter drugs. Yeah, I feel the best way is just to go to the hospital.
Okay. Now, wait, sorry to ask this one before she asks my own. Are there some that are incurable but can be managed?
Yes, there are some that cannot, like HIV and AIDS now, it's not curable. And there is a stage where HPV will get to, and it's not curable. Yes, and hepatitis B is not curable too. I don't think there's cure. Yeah, it's not curable. It can only be managed. All those conditions can be managed. Yes, hepatitis B, HPV is curable. Depends early.
If it's early.
Yes, if it's early, it's curable. Like if they have not gotten to extreme level of cervical cancer, it's curable. And the last one that I mentioned, hepatitis B, is not curable.
But it can be managed.
Yes, it can be managed. It can be managed.
And one can still live their full lifespan of life.
Yes, yes. As long as the person is meeting the treatment regimen, taking drugs at the right time, it is managed.
Okay, so you've talked about our personal way of curbing that. What about our government? What about non-governmental organizations? How can they help in curbing these STDs? Okay,
there are different ways they can help. First is condoms should not be sold at a very big price. It shouldn't be free. I think there was a time where condom was free. I don't know if it's still free, but condoms should be free, and there should be they can put it into. I think it's even currently in the curriculum. Secondary school student curriculum, teaching students what exactly is sex educating students, dangers of HIV/AIDS. Another way is outreach. For people that they don't have opportunity to go to school and benefit from the curriculum, they can outreach, tell people, gather people around, tell them about this is this disease, this is how you should prevent it. Yes, and what else? And also there should be governments should do training for the health workers too, because while Mommy Shai will be telling Mommy Ade that this person came to the hospital today and the person have HIV, it's not actually fair. There should be confidentiality in the healthcare system.
But I think they teach it in their schools. I don't know why many of them still go ahead to
Yes, I don't think that will happen in tertiary hospitals. Like, no, you know, there are different stages of healthcare. I don't think it happens in tertiary hospitals because the doctors don't even know you. Like, you understand? I don't think doctor, but in all these, you know, local
primary health care centers.
Your neighbor is there. You know, that's what primary health center is for, to bring people in the society together and work. Yes, so that's one. Yes, that's what can actually cause it. So, and you know, over familiarity now, oh, this is my neighbor, it's not be good if I don't tell her, oh, and her child is sick, oh, you know, I don't know, you know, and those health workers, you know, they are not really, it don't even have to be health worker, it can be cleaner, you know, cleaner, I don't think cleaner, you know, they could have told them, don't tell, but they'll still tell. But they'll still tell you. I don't think, you know, a properly trained health worker won't tell. But you know, the cleaners, people that are not really trained, that are just there for, you know, little help, and actually tell. And
no one wants their history to be known on the outside. No, the way they will say that. The Yorubas will say, "Kayima share, yeah." The one not know the whole thing at the end of the day. But then, I mean, that means the best way to really stay off this thing is
just to abstain.
Just abstain.
Yes, perfectly.
But what about, you know, some people, even if they try to, I made a joke, what if they try to, even if they try to abstain, some are raped into things like this and go. I don't know how those ones could. God.
Yes, that rape. That's why we should reduce stigmatization. So when a girl is raped, she should come to the hospital straight. You know, there are a lot of things that can be done to stop it. Even HIV can be prevented at that point, because there's what they call post-exposure prophylaxis. That when it's given for 3 months, the person can't have, like, if the person take consistently the drugs prescribed for 3 months, the person will come down with, the person will not come down with HIV. You know, and there are series of tests. You know, they can take sample tests. What, you know, what's this person at risk of having? Yeah. So if the person that is raped speaks out and proper care is taken, I don't think the person will come down with any STD.
Oh, well, thank you so much, Dr. Favour, for that. But then we really appreciate this in the actual sense. And wow, like she said, please, I beg, abstain. And like she said, if in case you abstain and you are now raped into it or maybe cajoled into it, the best place to be at is hospital. And thank you for talking about the fact that people should learn what they call confidentiality when it comes to health workers. Nobody wants their history known in the open, like we all say. Let the world not hear me and all those kind of things. And cool. But thanks so much again for being a part of this discussion. Really appreciate. And all, thanks for bringing to light these parents out there. You've heard what she actually has to say. And if you like, don't train your words. If you like, train your words. And if you like, you that you are a youth like me and you are hearing this and you are still going about your mythological beliefs that everything will be okay, just keep on doing it, don't worry. One day we'll come here to tell you more about cure. And you could meet her at the hospital to helping you and telling you, since you don't want to have sense, this is what we're going to do for you at this particular time. Thanks so much once again for being a part of this. It's time to take sports. After sports, we come back on Daybreak Africa and we conclude. So please stay with us. We'll be right back.
Welcome back from sports, and I hope you guys learned one or two things from the guest segment that we had earlier with Favour. And honestly,
no, it's not honestly again, no. It's a very serious matter.
It is a very serious matter.
Extremely serious matter.
Not actually joke about. You should look at the story you actually shared at the beginning of the show, whereby the lady had to, you know, keep that side of her from the man you intend to marry. That is really, really wrong.
Why do you even keep such kind of information from people? That's one. There are some that they do it intentionally. I know people. There was a girl that was recently arrested, and she said she was doing it intentionally because of her boyfriend gave it to her.
So she's
spreading.
Oh my God.
So guys that were foolish enough was thinking that she doesn't like condoms and all that for satisfaction. They never knew it was intentional so that she could pass the disease. You know, that's why even married men these days, I do advise, and married women too as well. Like, the reason for marriage is so that you could curtail your partners. You get? And if you are now in that institution and you are still going out to go and still be servicing, pity the person that is your partner. What are you bringing to that person? What's that person's history? I think discipline is a very important thing. The thing she said, abstinence, is very, these days our virginity is not a trend. Sure. But the truth, if we were to look at it, virginity, forget the hype, is safety.
It's safety.
It's safety, because if you are safe, it's better. This one that you are not in vogue, and your life is long, it makes more sense than you are in vogue and you're already dealing with. Because imagine some of these things can't even be treated and cured completely. So you have to manage it till the day you die. You know what that means? Even when you give birth to a child, you have to even inject that child so that they will not have what you have, so that they will be immune to it automatically. It's scary. Honestly, very scary.
So please, prevention is better than cure.
It's better than cure.
Stay safe. Very, very important.
And in case you have, please find a hospital. Enough of local drugs. It's very, very important. We will not cry over you as time goes by. But then let's leave it at that, because they say that a word is enough for the wise, not plenty words in the actual sense. So make do of what you can make do with this advice we'll be giving to you on Daybreak Africa today. But till we meet tomorrow for another beautiful edition on Daybreak Africa, my name still remains Ikhonede Joshua Odeji.
My name is Miracle Odunayo.
Bye, guys.